See that picture there? Never seen him as a happy grandpa. See the picture of the paper?
Yeah.
I don't have seen that.
I had started to get denial letters or refusal to pay letters from Blue Cross and Blue Shield, who was my insurance provider for 25 years. They decided that they were going to deny my follow-up care. I thank God that I had a husband who, every letter that we received, he wrote a quote. Doctors will tell you that being told that you have cancer and not knowing just what's going to happen to you, that you should not be put in stressful situations. I have to tell you that it was one of the scariest times in my life because I was put in a very stressful situation, concerned about a breast that had become infected, concerned about the fact that my insurance provider, Blue Cross and Blue Shield, would not pay for some of my follow-up care. Caused me a lot of stress. I was very thankful when I became 65 because at that time, today, that I don't have to come out of my pocket anymore because Medicare pays for my insurance policies.
Come in who have lost their jobs without insurance, who come in with simple ailments that could have been treated if only they had access to medical care. Because they do not have access to medical care, it causes us at Cook County Hospital to take in a lot of patients. It's breaking our healthcare system. It's really breaking down because we're the only safety net. Right now, our ratios at Cook County hospitals are off the chain. Nurses are working, seeing patients from one end of the hall to the other end of the hall. It hurts me as a nurse that I can't take care of patients who come in with illnesses because it could have been treated if only they had access to health care. But because they don't have access to health care, wrong with this system that we have. We already have something in place. We have Medicare. Medicare is a system that can be working for everyone. We don't have to We stand with our organization, the National Nurses Organizing Committee, and we stand up for universal health care because we know how important it is for the residents of Illinois to have health care. It hurts me to see patients come in with ailments that could be treated. They wait for days and days and days and days, getting sicker and sicker and sicker. Why? Because they don't have health care. I don't know what the problem is. We don't have to have a lot of scientists. We don't have to have a lot of geniuses to reinvent what we already have. We just need to expand it to everyone. So everyone will be in, and no one will be out.
Must be to provide universal coverage for every single American.
And so in the barrios and the ghettos and the trailer parks of our nation, for the uninsured in our nation, in order for us to save our healthcare system, we need a legitimate, real public option that works for all of Americans. Myth number 2. Health reform means the government will ration health care. No. The present system of private insurers already rations health care by denying you full benefit and high-quality health care for the American people that is affordable, forcing the private insurers who want some of the new market share, that is, the 47 million Americans who have no form of coverage whatsoever, many of whom will find themselves in the public plan. If those private insurers want to increase their profit margins, they have to bring their costs down to compete with the public plan to come over here to get some of the 47 million